is, how do you make a urologist moan? She provides services and doesn't get paid. In this video, I'm interviewing Dr. Rao, who is one of the founders of Ankr. Very innovative type of service so that you don't have to work for free anymore. So let's talk about the typical workflow when you get a patient message. You typically call the patients back and hopefully you're documenting in your EHR, but you're not getting paid for it. There are tons of these messages that accumulate throughout the day, every single day. All that work that you're doing is unfortunately for free. Well, that is about to change. I'm going to have Dr. Rao explain the Ankr product and how that may change how you work and stop working for free. Dr. Rao, thank you so much for coming on and discussing your topic and your product.
Dr. Lin, thank you for having me. I'm super excited to share, the reason why Anchor's been created in the first place.
So tell us, how does this work and how are you changing this concept of physicians and urologists doing work for free?
Yeah, so I think, we all, especially you guys, I was a medical oncologist practicing up until 6, 7 months ago before I moved to Anchor full time. And, you wrap up your busy day, you come out of surgeries, and 5 p.m. comes around, your staff's gone home, and now you're sifting through 20, 30, 40 messages that have come through. You're probably not going to call everybody, but you're going to call 3, 5, 10 people. If that sounds like something you do every evening, you're losing, as a doctor, you're losing about $100,000 minimum in revenue every year. Not only that, that's time away from your family. That's causing burnouts. That's hard to sell to a new person joining your group, right? It makes you less competitive against, some of the bigger players in your market. And so that's the problem that Anchor was really designed to solve is how do you have the doctor recreate all of the support system that exists until 4:30 p.m.? How do you recreate that on demand? That was the question that we were able to
On
solve.
demand.
Yeah. Yeah, so like during daytime, you have your MAs, you have your front desk, you have your scribe, everybody's supporting you and making those visits happen. Anchor takes on the functions of those personas once they've gone home, right?
Mhm.
And so that's the essence of it. And our customers are realizing revenue where it didn't exist, and for the work they already do, and without needing any new staff.
So tell us how this works. Say at the end of the day, I have 15 messages in my electronic health records inbox. After integration with Anchor, how would that process look like?
Yeah, so Anchor's embedded in all the major EHRs you can see behind me, I guess, but Epic, eClinicalWorks, Athena, you name them, and it launches from inside your EMR. So when you're reading that patient's chart, you have the option of starting an Anchor phone visit or an Anchor video visit. Once you click that button, let's say for simplicity's sake, let's say you want to do a phone visit, right? It's 5:30 p.m. Right now you want to do a billable phone visit. You click the Anchor button. Anchor's going to dial the patient, check if it's a human being or a voicemail answering. If it's a human, Anchor's going to walk them through the consent for a billable phone visit or a billable video visit. Get the interpreter on the line if it's not an English speaking patient automatically. And all this happens in about a minute. 1 minute after you click that button in your EHR, you get a call on your cell phone from Anchor. The patient and interpreter are ready on the other line. You start talking to that patient in the background. Within blink of an eye, Anchor sets up an appointment for that patient on your schedule, verifies insurance, completes the intake process. All of the stuff that your staff is doing during the daytime, Anchor's doing within milliseconds, right? And so now you can focus on patient care. You can talk to that patient for 5, 6, 7 minutes, whatever your time is. And once you hang up, Anchor prepares about 80% of a billable clinic note. So it drops in, the reason for visit. It drops in the informed consent. It drops in the start time, end time. All of the things you need to put in to make sure you're paid for that visit. What this means for you, when you're done with an Anchor call, it all flows back into your EHR. So you code and bill like every other visit, and that makes it the same 5 minute conversation. It goes from $0 in revenue and a lot of hassle to no hassle and about $75 in revenue.
It sounds like you are taking all friction points from doing a telemedicine visit, basically a callback at the end of the clinic. For years, we've been doing this for free, and we should definitely stop doing that because patients are not just paying us urologists to do the surgery, but for the cognitive work,
Hmm.
for the experience, and that experience comes out and is delivered when you are doing a telemedicine visit, when you are doing that phone call that you've been giving away for free. You don't get a lawyer on the phone for free whenever you get whenever they're exchanging information on an email. Heck, even email, all the free email exchanges that you're doing through your portal, that is charged by the lawyer. They're paying you're paying them for their experience and their knowledge. Likewise, patients should be paying for your experience and knowledge. I do a lot of vasectomies.
Yeah.
I tell the patients that when they ask me why are you charging so much, I tell them that you're not paying me for the 5-minute procedure that I'm doing. You're paying me for the 30 years of schooling and experience
Right.
so that I can do this procedure for
In
five
five
minutes.
minutes. Right.
Likewise, when we're doing these telemedicine or the phone call visits that we've been previously doing for free, you should stop doing that. Basically,
Yeah.
we should have a different mindset. Your product makes this process of calling the patients back a lot easier
Hmm.
and be able to capture that revenue that we've been losing.
Yeah.
And you said it's possibly $100,000 per year per provider.
These are Dr. Lin, and for so you've hit on two really important concepts here, right? One is what is the revenue opportunity here? This is not our numbers. These are numbers from large health system, from larger urology groups, from large cardiology groups, GI. They've done their own independent financial modeling on Anchor product, our existing customers, our prospects, and they've come up with the $100,000 per provider per year number. And this is a conservative estimate. So if you're doing 3 or 4 Anchor visits a day, this is how much you can make. If you're doing 5, 10, that number only goes up. So that's the revenue. And if you have a 5-person group, $500,000 a year. Why would you leave that on the table?
Well, what makes me sad is that we've been giving that away for free.
Yeah. And yes, doctors are great people, absolutely. Independent medical groups are the beating heart of our country's healthcare system. And the consolidation that's happening, private equity buyouts. Do you not know a friend that's either sold their practice or has been forced to go out of independent medical practice because of the market trends? Like this could be the game changer that they need, right? And for the work they already do without needing any additional staff. Which the other question that people ask us all the time, and very valid question, is why would my patient want to pay for this? You imagine that patient that calls you on a Saturday, like this is a real example. I can't give the medical data, right? But real example, a patient called in, blood and urine on a Saturday evening around 5, 6 p.m. to one of our customers. That patient got a call back through Anchor, a full phone visit, about 11 minutes long. That evening, within 5, 10 minutes from receiving the initial page, and we found out that patient could have been sick enough where they would have needed an ER visit that night, and that visit was prevented because of Anchor visit. So what this looks like from a patient's point of view is they got a real doctor calling them back right away, and they spent $25 of copay and prevented $1,600 of ER visit costs. Now, please tell me if that's not a good enough argument
I
for
mean, it's a
patients.
win-win-win for the patient, for the healthcare system, and also is also a win for the physician.
Yeah, absolutely. On a macro level, you're just empowering the right person to deliver the right level of care, no matter what time of the day. And
Timeliness, the right place, right person, right time.
yeah,
That's key. Now we can go into a lot more detail regarding this technology, but I'm just here at the Texas Urologic Society meeting. I'm giving a presentation tomorrow. Happened to run across Anchor, and I thought this is really innovative. Nothing out there like it, and I figured it's important enough that we can do a quick interview. I'm going to definitely do a much deeper dive with you later on. We'll do a presentation, a Q&A, and I'll bring it into the Facebook group so that they can ask questions in real time regarding this integration and technology, which is exciting. You briefly mentioned how part of the note is captured in your EHR. That's done through AI in the background. So that's really exciting. We'll
Yeah.
definitely have to get into
Yeah.
that some more.
Yeah, we can go like Anchor can recreate most of the basic clinical workflows, no problem. And then if you want to dial up the fanciness, we've got integrations where we can create notes for you. We can actually drop in orders for you. So all kinds of things are possible. But this is what we hope is the future of at least a portion of care delivery in
And
the
that's what got
U.S.
me so excited when I started hearing about all the things that it can do automatically in the background, leveraging AI and actually putting in orders. So all you have to do is look at the note at the end, make sure it's accurate, put in some changes or add in more color if you wish,
Mhm.
making sure it's accurate, sign off on it, and you're done. Your billing staff will already have the information to capture the revenue generated from this encounter. It's really, it's a true win-win-win. Thank you so much, Dr. Rao.
Thank you, Dr. Lin. Thank you for having us and featuring us in front of your audience. Appreciate it.
And as always, I will put the link to Anchor in the video description and possibly your contact information. So if you're interested, you can contact Dr. Rao.
We won't charge you for the after hour call. You're welcome to call anytime.
You won't charge for the after-hour call. Love it. So that means we can call you at 8 o'clock at night on the weekend.
For us, yes,
Okay.
yes, yes. We're always there for you.
All right. Thanks. Thanks for watching.